Hello and thank you for coming back. This is Module 3, Part 3, Chapter 17. I will continue on with the effects of analgesics. I left off on this slide from Part 2. As you look, I want to focus on our aspirin, acetaminophen, short-acting opiates, long-acting opiates, common side effects of opiates, and nursing guidelines for older adults taking analgesics. Make sure that you pay attention to side effects of aspirin and acetaminophen. So bleeding, dizziness, vomiting, prothrombin time alteration. Acetaminophen lacks anti-inflammatory, so when you tell a person you're giving them acetaminophen or Tylenol, let them know it doesn't have any anti-inflammatory. It doesn't have inflammatory properties. But sometimes some of the Motrin products does. As you read the many bullet points of guidelines and analgesics, I would like to point out that make sure that you explore the non-pharmacological means to manage pain. Also, because bleeding and delayed clotting times can result from long-term aspirin use, observe for signs of anemia, bleeding, altered hemoglobin, and also your prothrombin time. That's your bullet point right down here that I read from. So make sure you look at these things. So when a patient, and also observe for their stools, making sure that they're not having black stools or coffee brown emesis. Next, I want you to look at this bullet point as you note the signs and signs of salicylate toxicity. Look at this, because a lot of times you see right here, and people always miss the tinnitus, the ringing in the ears. So make sure you understand that these are signs and symptoms of toxicity. Okay? And I also wanted to look at the use of, make sure that they're using narcotics very carefully. I know it's a circle, so I'm trying to keep it over here so I don't obstruct your vision. But make sure you use, they're using narcotics very carefully, because if they're driving, it can alter their sensation of their mental sensation, and they may become drowsy and may be involved in an accident, or if they're at work and they're operating heavy machinery, things like that. Sometimes older adults and patients as a whole accidentally overdose on analgesics, and our poison control line is what we use in the hospital to get further recommendations. The poison control line is 800-876-4766. As you review this slide, effects of antacids, and review each of the bullet points, I just wanted to reinforce up here where you making sure you assess the reason for the antacids. Okay, sometimes we're overlooking something that's underlining. Sometimes it could be cardiac that's going on with the individual, and they're taking an antacid to decrease that heartburn, quote unquote. So make sure that we assess the reason why they're are using the antacids. Also, we want to make sure that we reinforce with patient teaching, avoid administering other medications with antacids within 2 hours of administration. Okay, so make sure that you tell patients in their own antacids, make sure that you say avoid administering other medications within 2 hours of administration of an antacid. So make sure that you just be a good nurse and reinforce that. You can also say the rationales to prevent the antacid from interfering with drug absorption. Okay, so make sure that we reinforce that with our older adults, okay? And let them know that also that sometimes constipation can result from aluminum hydroxide and calcium antacids. One more thing with the one more thing with advising the patients. Also, if they're on a low sodium diet, make sure you tell them to avoid using sodium bicarbonate as an antacid. As you review the effects of antibiotics and all the different bullet points, I want to make sure that we reinforce the side effects of antibiotics. They do cause abdominal cramping and diarrhea. So being an advocate for our older adult population, we want to make sure, hey, this patient's on 2 different antibiotics. They're more than likely going to be at risk for having diarrhea. Let me ask the physician if maybe the patient can be on a probiotic first to try and, while they're on antibiotics, to help with the effects of the stomach cramping that he or she may develop. And then after which, if the diarrhea consists too horribly, they may need to stop the antibiotic, change it, or put the patient on an anti-diarrhea medication. And I know that we all know, but making sure that when patients are started on antibiotics, if there's any cultures ordered, make sure that we obtain the cultures before starting the antibiotic. As we are reviewing, Yes, I'm correct. As we're reviewing the effects of anticoagulants, I know we have a lot of bullet points down here, but make sure that we also focus on the high risk for bleeding. Okay, so we want to make sure something as simple as when you're brushing your teeth, are you having any bleeding from your gums? Monitoring your urine, you notice any blood in your urine, any petechiae, any streaks of blood in the stool. Those are always good to know, especially with these anticoagulants. Patients are on heparin and Coumadin. Make sure you know the antidote for heparin and Coumadin. Make sure you know that the antidote for the anticoagulants is vitamin K. Know your normal ranges. Know what your PT and your INR is. Know when to get that emergent fill-in when you know that a person INR is 3 and 4. They're at risk for bleeding. So you need to know what your normal ranges are. Know what the physician and the pharmacist want to keep this patient in when they're on anticoagulants. Okay? So some physicians want to keep the INR between maybe 1 and 2. But if you're getting results back there saying 3 and 4, this patient blood is a little bit too thin, and they're more than at risk for bleeding. Okay, so we want to make sure also with this, we want to educate our patients about the need to be careful about diet. A large intake of vitamin K rich foods, and I believe that's somewhere here. There we go. Large intake of vitamin K rich foods. So I won't read that, but make sure you read all of this. Okay, that's very important, especially with our teaching. As you review effects of antihypertensives, make sure that you perform orthostatic vital signs. That's very important. And make sure you do the orthostatic vital signs correctly as you have been taught. And also here it says help patients in learning and using non-pharmacological measures to reduce blood pressure. We can do some relaxation, we can turn down the lighting, we can avoid foods high in sodium, have a high fiber diet, increase exercise. Things like that will help reduce our blood pressure. Here I want you guys to pay close attention to what should be monitored. So you monitor patient closely when therapy is initiated. Okay, some of the antihypertensives can cause significant hypotension initially because these patients were used to high blood pressures, and now the medication is lowering their blood pressure and they feel like they're hypotensive, or they actually might be hypotensive. Please continue to read on to each one, as each of these bullet points are very important. As we review the effects of antidiabetics, the medications, know that most importantly, your patients have some type of identification bracelet. So if ever they had a hypoglycemic effect or hypoglycemic event and they passed out, when someone found them, they would know that this patient is a patient who has diabetes, and they would need immediate help, and they would know what to do. It kind of helps them guide in their treatment plan. Also, make sure that we encourage these individuals to rotate their spots when they're giving themselves their injection. Okay, I don't want to repeat what's on here, but it is right in here. So it's right in here, a second area, as infection at the infection site can be caused by atrophy and hypertrophy associated with insulin lipodystrophy. Okay, it's harmless, but just they can develop that. Okay, first it starts off with the redness, the swelling, the pain, and nodules development at the injection site, and then it's like little enclaves in indentations in their skin throughout. So we want to make sure that we tell them. Also make sure that as a healthcare provider, we monitor for signs and symptoms of hypoglycemia and monitor their blood glucose level, and also incorporate the 15-15 rule when they are having hypoglycemic events. As you read these bullet points on the effects of the NSAIDs, I want you to make sure that you reinforce and read this twice. Okay? And also as a nurse, when we're given a medication, we need to make sure that we're administering these drugs with food or a glass of milk unless contraindicated to reduce GI irritation. Okay? So a lot of times I've had someone come in to the emergency room who were taking NSAIDs for whatever discomfort they had. They were taking it for months and months and months, and that person ended up with a major GI bleed. So we want to make sure that we educate about the medication and also know what the therapeutic window is. Toxic levels can accumulate much easier and at lower doses in older adults. So make sure you read all of the bullet points, but I just wanted to make sure that we evaluated, that we really reviewed, administer these drugs with food and food or a glass of milk. Make sure when we're talking about the effects of statins that we ensure the patient receives a liver function test and any other necessary test that's ordered. Okay, sometimes that is overlooked, and make sure that we assist the patient in implementing dietary and lifestyle modification to reduce cholesterol levels. High fiber diet, fruit and vegetables, also our lifestyle, exercising, and so forth. Okay. Please look at the effects of digoxin. As a nurse, we have to make sure before even giving a medication, we check the pulse rate, rhythm, and regularity prior to administering the medication. Also, bullet point number 2 is really detailed, but it's important. So I know there's a lot in here, but make sure that you look at this. So we do check for the DIG level. So make sure that you check your labs. If you have a patient on digoxin, go to your lab tab and see what the last DIG level was. Okay? Also look at their potassium. Check their DIG level and the potassium. Basically, just check their electrolytes to be on the safe side. As you look at the effects of the diuretics and what we as nurses should do, make sure you remember there are major types and actions. You have your thiazides, you have your loop diuretics, you have your potassium-sparing diuretics. Remember, potential for fluid and electrolyte imbalance when we use these diuretics, so we need to look at their labs again. And also these patients are at risk for dehydration. Okay, so we want to make sure that we monitor administration of the use of diuretics. As you look at the anti-anxiety drugs, make sure that you go down to the bullet point somewhere here. Advise caution in grapefruit consumption. This fruit can increase the concentration of the drugs. Speaking of the anti-anxiety drugs, okay? And also instruct patients to incorporate foods in a diet that can promote bowel elimination, as these drugs can be constipating. So you want to make sure that you monitor bowel. So you see how different things and different drugs that occur with the older population can affect their bowel. Dehydration can affect their bowels. Different drugs can affect their bowels. So make sure that we're monitoring them as a whole. Make sure when we're talking about antidepressants that we explore the use of other therapies in addition to antidepressants to improve the mood. Monitor the patient's plasma level of the drug. Also, look at the side effects that the drug can cause. Also, it causes risk for falls. And make sure that we monitor them for dryness of mouth, which can be uncomfortable. As we review antipsychotic drugs, I would like for you to pay attention to this bullet point. Also here, and with our men. We will have a part 4 as I will give a review for the upcoming exam or your medication, safe medication use. Thank you. Bye.